Hello everyone, good evening. Welcome to BAJIRAO IAS Academy, the Hindu News Analysis. So first of all, happy Holi for all of you and thank you so much for being here. And today also we have few important news articles that are given in the Hindu newspaper. So we will discuss all those news articles in a very comprehensive, in a very broader manner, so that the analysis will certainly help you in your prelims examination as well as your mains examination. So like every day we are discussing at least one previous year question or one current affairs based question. Today also I have one important question, but before discussing the important question, let's try to solve the yesterday's given practice question. Project Gaia was in news recently is associated with which of the following things? Option A, banking reforms. Option B, climate risk analysis. Option C, artificial intelligence and cybersecurity. Option D, climate smart agriculture. So the correct answer for this question is climate risk analysis. Okay, so Project Gaia was launched for the purpose of climate risk analysis. If we can go to the explanation part of this particular question. So this particular project is in news because central banks have recently unveiled this project Gaia. So this is primarily aimed at assessing the climate financial risks comprehensively. Please understand, climate change is a concern. However, climate change has necessitated climate adaptation. Along with the adaptation, climate change mitigation is also a very important things that we need to keep in mind. However, both climate change adaptation and climate change mitigation requires climate finance. So therefore, the central banks have come together and they have unveiled this particular project Gaia. So this is assessing the climate risks, climate financial risks in a comprehensive and a broader manner. So when we able to understand the financial risks that are being involved in the climate change, so then we can come up with more effective models of financing both climate change adaptation as well as mitigation. Now, if we can talk about this particular project, so it is a collaborative project between Banks of International Settlements, Innovation, Hub for Eurosystem Center and Bank of Spain. Okay, so this is actually a collaborative effort. So after that, it also utilizes regenerative artificial intelligence and particularly the large language models. So artificial intelligence and large language models will be helpful for analyzing the climate related risks in the financial system. Okay, so this essentially means that utilizing technology to assess climate financial risks so that we will have the evidence based or data driven approach, and that is a very important aspect because we have relevant evidence, relevant data, and accordingly we come up with new policies and new initiatives to understand and assess climate financial risks. So apart from that, it also enables examination of firm carbon emissions. Please understand the particular carbon dioxide emissions are responsible for global warming. So global warming further contributing to climate change, right? So therefore, it will also examine green bonds. So there are certain bonds called green bonds that are being launched. So these bonds are tradable bonds. Okay, so these green bonds are tradable bonds, and these bonds incentivizes individuals who have invested in technologies and renewable energy projects so that they make a transition from the fossil fuel based dependence or fossil fuel based economies to a less fossil fuel based economies. And apart from that, optional net zero commitment disclosures also. So all these things comes under the particular project Gaia, and this has been launched to assess the climate financial risks in a comprehensive manner. So if we can discuss today's practice question, the question is Operation Indravati is an Indian initiative to evacuate Indian citizens from which of the following countries? The countries given are Sudan, Russia, Haiti and Cuba. So please try to answer this question in the comment section. Now let's try to discuss today's few important news articles. So please remember, today is 25th of February. So 25th of February is also well known for Global TB Day. Okay, so Global Tuberculosis Day, 25th of February. So because of that reason, there was an article in the Hindu newspaper, and apart from that, the tuberculosis disease is a most pressing challenge that India and the world has been facing. The other thing that you need to understand about this particular TB disease is caused by a bacteria, and it is a chronic disease. And the TB causing bacteria has also been developing antibiotic resistance or antimicrobial resistance. So thereby it has been posing more and more challenges in order to treat this particular TB disease. So before discussing this in a comprehensive manner, please understand the syllabus from which you can get the question on this. So in prelims, governance part, healthcare, TB elimination program 2025, you may get a question in prelims, and mains, governance, healthcare system in India, issues related to TB and the concerned measures that are being taken by the government. Now, why this is in news, why this particular TB disease in news is because World TB Day is celebrated on March 24. So sorry, I've told February 25. So it is celebrated on March 24. Okay, so World TB Day is celebrated on March 24, and therefore we must recognize the needs and interests of TB patients. So it is very important that we must recognize the needs and interests of TB patients, and communities must form the basis for disease elimination. Okay, so because of that reason, it is in news. And apart from that, if we further proceed to discuss this, the theme of World TB Day 2024 is yes, we can end tuberculosis disease. So this is the theme of World TB Day. So that is, yes, we can end this tuberculosis disease. Please understand, I have already told you that TB is a chronic disease, and countries like India have been suffering a lot to eradicate the TB disease because TB disease has developed antimicrobial resistance. So this particular resistance to existing drugs, so thereby posing new challenges. However, Ministry of Health and Family Welfare, the concerned ministry which deals with these type of diseases, so along with different developmental partners, it has launched Tuberculosis Mukt Bharat, that is TB Mukt Bharat. Okay, Tuberculosis Mukt Bharat Abhiyan in 2021. Okay, so Ministry of Health and Family Welfare has launched TB Mukt Bharat in the year 2021. So this was launched under the NSP India 2020 and 2025. So particularly for the elimination of TB. Okay, elimination of TB. Okay, so TB elimination program 2020 and 2025 was launched by Ministry of Health and Family Welfare, and it is considered as a major mission activity for ending TB disease by 2025. However, if you look at the progress that India has been made with respect to eradication of TB, it is a very minimal progress has been done in order to achieve the TB disease. However, so despite there are ambitious goals to eliminate TB from India, so India's health authorities were largely failed to eliminate TB from our country. Okay, so therefore the challenge is huge and progress is not fast enough with this respect. So that is with respect to elimination of TB. However, why there is a need for a person-centered approach to TB care and management? So the question is that why there is a need for person-centered approach for TB care and TB management. why we need to have a person-centered care. So first and foremost, we need to understand through shift, paradigm shift. So it essentially emphasizes on a care which should be centered around one person who is impacted with the TB disease. So there are multiple reasons for that. Because of this reason, several experts have been suggesting a person-centered approach in TB care and TB management. Firstly, TB as a human crisis. We need to understand TB in terms of a human crisis, because TB is one of the major causes of mortality worldwide. So TB is a chronic disease. So since TB is a chronic disease, over a period of time, what happens, it increases the overall mortality of the individuals. And India has the largest burden of TB, so therefore we need to act on this front and we should eliminate TB from our country. Okay, so apart from that, the trend of increasing TB cases and the drug resistance that is being developed in tuberculosis is a very disturbing. So I've already told you that Ministry of Health and Family Welfare has come up with a TB elimination program. So even though this particular program was launched to eliminate TB by the year 2025, we have not made tremendous progress on this front, because it is evident from the fact that the TB cases have been significantly increasing, first thing. And second thing is that TB has been developing resistance. TB has been developing resistance to existing drugs. So when it develops resistance to existing drugs, even if you take drugs to cure the TB, they are not effective, and that ultimately leads to the increasing mortality of the people. So that is the main cause of main problem with respect to the tuberculosis. So after that, TB should be considered as a gendered crisis. Now, why it should be considered as a gendered crisis? The author has been suggesting that we are living in a gendered society. A patriarchal barriers are there for women. So therefore, women and other gender minorities, they are living in a violently patriarchal societies. Now, what is a patriarchal society here? So patriarchal society means a society where there's a huge male dominance. So every decision is being taken by the male members of a family, and the female members will enjoy a far lesser decision making power in a patriarchal society. So here the author has been suggesting that women are living in a violently patriarchal societies. So those women who are living in those patriarchal societies facing number of challenges, okay, particularly with respect to assessing timely diagnosis and treatment of TB. See, understand, it is very important that TB disease should be diagnosed on a timely manner so that adequate and appropriate interventions can be made to prevent the further spread of this TB disease. However, the author suggesting that the violently patriarchal societies have been placing barriers for women accessing the timely diagnosis and treatment for the tuberculosis. Secondly, it is very difficult for the certain gendered minorities to seek care due to structural and social barriers that are present, and at the same time the stigma that is being attached with the TB disease. And in fact, widespread poverty has also been disincentivizing and discouraging people to access the healthcare, the larger healthcare benefits. Okay, so these are some of the challenges that are being associated with. So after that, we should also talk about the economic challenge. We should not neglect this. So economic challenge is a huge factor that has been playing a key role in the diagnosis and treatment of this disease. Remember, when I said this is a chronic disease, it is a long-term disease and long-term treatment is required. So several poor people who are impacted with the TB disease, they cannot afford such long treatments. Okay, so what they are doing, they just left the treatment midway, and that further increases the intensity of this particular TB disease, and that ultimately leads to the mortality among the people. So therefore, the largest indirect costs that are being associated with the tuberculosis for a patient is income that is being lost because of being too sick to work. For example, imagine a person and who is infected with the TB disease, and he will fall ill, right? And he cannot go to work because of this TB, and he will lose income, and ultimately he would be trapped in the poverty cycle. So therefore, he would not have adequate means to sustain himself, and family will also not take care of this particular individual because he is not going for work. So all these factors will play a very important role in elimination of TB. So we need to look at it in a holistic and a comprehensive manner. Only then we could be able to achieve the target of eliminating TB from India by the year 2025. Almost 1 year left, but still we have not made significant progress on this front. However, there are a number of studies that are being conducted, and these studies have been indicating that average 3 to 4 months of work time is being lost. So this individual impacted with the tuberculosis disease, and he will be ill and he cannot go work, and it is said that due to TB around 3 to 4 months they're not going for any work. So therefore that has been resulting in the loss of 20 to 30% of their earnings. So 20 to 30% of their annual household earnings, and that will ultimately leads to the poverty. Okay, so apart from that, the children in their households, in these households, may not go to schools because the sole breadwinner, if he is infected with the TB disease, then someone should go for work. So that will also increases the problem of child labor. So therefore it is having a multiplier effect. The TB disease having a multiplier effect, and because of that reason we need to look it from a holistic perspective. After that, tuberculosis is very often a social and environmental challenge also. We have looked it from the perspective of economic. On the other hand, this is considered as a social and environmental challenge as well, because for centuries tuberculosis has been linked with the environmental risk factors. So those environmental risk factors very often go hand in hand with the poverty, right? Because poverty, environmental degradation, and the social conditions of the people are actually interlinked with each other. So therefore, for centuries, TB has been very often linked with the environmental risk factors that actually go hand in hand with the poverty as well. So apart from that, indoor air pollution, because of traditional stoves are being used, particularly by women, and tobacco smoking, malnutrition among the children and the lactating mothers and adolescent mothers, overcrowded living conditions, and excessive alcohol use, all these factors have been further driving up the vulnerability for people to TB disease. Okay, so now care needs to be more and more humane. So what should be the solution? That TB has been impacting the people, so what should be the solution? The solution is care needs to be more and more humane. So it needs to be more and more humane. So that essentially means that need for strengthening community-based care. See, a community involvement or community management of resources or community care, everything are a very important thing, very essential aspects in order to achieve the success of any objective. So therefore we need to strengthen the community based care, particularly the primary health care centers. We need to strengthen the capabilities. We need to modernize the infrastructure in the primary health care centers, and we need to train workers such as ASHA workers and ANMs for the early diagnosis of TB disease. So early diagnosis of TB disease will ensure that appropriate interventions can be made with respect to this particular disease. So therefore, the author has been emphasizing on community-based care has to be strengthened. So therefore, strengthen community-based TB care models, empowering the frontline healthcare. Now, when I say frontline healthcare, they include ASHA workers and ANM workers also. So therefore, they can deliver the comprehensive care because they regularly be in touch with the local households, and they can easily identify and diagnose the TB disease. And the problem is that people are not seeking the medical care even if they are impacted with the TB, and that has been increasing the risk of mortality. When these ASHA workers are able to identify the TB disease at an earliest stage, we can come up with an appropriate interventions, and we could also make sure that the impacted individuals would be relieved as early as possible. So because of that reason, we need to strengthen the capacities and the capabilities of the frontline healthcare workers, so who can deliver the comprehensive care closer to where patients have been living. So after that, we need to address the discrimination also, because I've already told you that this TB disease, very often whenever a person who is being infected with the TB disease, he has to go through a lot of discrimination, the social discrimination and discrimination within the family also. So therefore, we must address the discrimination on this front, because TB can affect the people of any class, not just poor, but TB can infect a people of any class. So any religion, any ethnicity, gender and socio-economic status. So there is no bar on the vulnerability of the people to TB disease. However, it disproportionately affects the most marginalized individual, most marginalized and poor people, such as children, urban poor, prisoners and people who are living with the HIV/AIDS. So these are the people who are infected with these diseases. Now, so it is needed to address that disease has gone beyond a being health crisis alone. So this is a health crisis, and that requires holistic and comprehensive solutions from the government side, and at the same time the community engagement or strengthening the community healthcare is also very important to deal with the tuberculosis disease. So in this regard, how technology can be used to address these challenges? Because it is said that technology has a crucial role to play to eliminate the TB disease or to achieve the target of TB Mukt Bharat. So how technology can be leveraged? The adaptation of artificial intelligence and the digital health solutions. I mean, seeking healthcare through digital means. Okay, so that is telemedicine. So those things will help in TB diagnosis. TB diagnosis is very, very important. So this is the first step that has to be taken whenever we wanted to eliminate the TB disease. TB diagnosis is very, very important, and adherence, regular surveillance, monitoring, all those things can be done using technology and innovation. Okay, so this can particularly revolutionize the way TB care is delivered and assessed in the country. Okay, so please understand, technology has a lot of role to play, particularly with respect to the tuberculosis disease, and India has been made a very limited progress with respect to eliminating the TB disease. So therefore, in order to eliminate the TB disease, we need to look at the multiple ways through which we contain the spread of this particular disease and reduce the mortality, because it is having a lot of impact on the economic growth and economic development of the people. And it requires attitudinal changes and behavioral changes from the people at the local level, and it also requires strengthening the existing healthcare facilities and health infrastructure at the community level. So all those interventions are very important, and among all those interventions, the technology and innovation aspect or interventions are very important. So that can effectively addresses new challenges that are being posed by the TB disease. So apart from that, the system for TB elimination in private sector, it is also called as STEPS. Okay, system for TB elimination in private sector. So this was an initiative that was introduced as a low cost solution to address the gaps in quality care for TB patients accessing the private sector, accessing healthcare in the private sector. So this is actually a low cost solution to access medical care by the TB infected people in the private sector. Okay, so this is all about the tuberculosis disease. However, the objective of eliminating TB by the year 2025 may not be achieved, keeping in mind that the limited progress made by India in this regard. However, it requires a holistic and a comprehensive approach, and leveraging technology is also very important in this regard. So that will help us achieve the goal of TB Mukt Bharat, and at the same time we need to ensure that healthier India. So that particularly requires integrated planning, evidence-based and data-driven policy making, and even the collaborations between different tiers of governance to ensure that we are free from the disease called tuberculosis. So this is what the author has been suggesting in this particular article. Now let's try to discuss the another important news article, that is the resurgence of mumps in Kerala. Okay, so recently in Kerala, a viral disease called mumps has been spreading at a faster pace. Okay, and it has been particularly impacting children who are in the adolescent age group. So in this context, we will understand what is this mumps disease, and at the same time, so why Kerala has been witnessing a higher rate of mumps disease, why it has been spreading faster in states like Kerala and impacting children, and why there's no vaccine included in the universal immunization program for this mumps disease. So we will understand everything in a very detailed manner, but before going into the discussion part, so let's try to understand this. For example, a girl which you see on your left side is a healthy child, but on the other hand you can see a difference between child A. She is child A and she is child B. Okay, so she is a child with mumps disease, right? Now in this context, why this particular disease is in news? Please understand, mumps is an acute viral infection. It is caused by a virus and it affects children, and it has been spreading like a wildfire in a state Kerala for the past few months, right? So mumps disease has been spreading across Kerala like a wildfire. Now if you talk about this particular mumps disease, it is an airborne viral disease, and it primarily affecting children at the adolescent age. So it actually manifests symptoms like fever. Okay, so they will be infected with the fever. They also get headache, painful swelling of this salivary glands. So you can see here the swelling of the salivary glands is reflected here. Okay, so painful swelling of the salivary glands, and at the same time the swelling of parotid glands on both sides of the face. Okay, so it has been impacting the children who are in the 5 to 11 years of age group, and they are being affected by the disease called mumps. Okay, so symptoms, as I have already discussed the symptoms: pain, tenderness, swelling in one or both parotid salivary glands, and affecting neck, jaw and cheeks. So children who are impacted with this particular mumps disease have high fever, weakness and headache, and they also have difficulty in swallowing, eating, and in certain cases it can also lead to brain and heart swelling and morbidity and even other problems. However, when we talk about the prevention, the MMR vaccine, mumps, measles and rubella vaccine, is available for under 600 rupees per dose. So we'll discuss that later. So firstly, understand the context of this mumps disease. What is the context of mumps disease? Now, as I have already told you that this mumps disease has been spreading like a wildfire across Kerala. Okay, so despite being a vaccine preventable disease, okay, so mumps is a vaccine preventable disease. As I have already told you, there is a vaccine called MMR vaccine. With the help of this particular vaccine, this mumps disease can be prevented. Okay, so however, it is not part of the universal immunization program. So despite it can be prevented through the use of vaccines, it is not part of the universal immunization program. There are certain vaccines which are included in the universal immunization program, so that protects children from several dangerous diseases. But on the other hand, mumps is not included as a vaccine in the universal immunization program. So why? Because the disease has hardly no mortality. Okay, so it has no mortality profile, and the perception is that it has a very low public health significance. The general perception in governments and the healthcare institutions and the research facilities is that it has a very low healthcare significance and it doesn't cause mortality among the children. Okay, so it doesn't cause mortality among the children. So because of that reason, it has been not included as part of the universal immunization program. However, according to the World Health Organization, vaccine strategies targeting mumps control should be closely integrated with the existing measles elimination and rubella control. So World Health Organization has been saying that in order to control mumps, we need to integrate the vaccine of mumps with measles and rubella. So vaccine strategies should focus on these three diseases: mumps, measles and rubella. However, it is a cause of concern. Is it a cause of concern that we need to understand? First and foremost, that we need to understand it is a self-limiting disease. So self-limiting disease means that it resolves on its own. In fact, even medical intervention is also not required with respect to the mumps disease. So because of that reason, we said that it resolves on its own, and at the same time, we can manage the symptoms at home, and those symptoms management or we can relieve from this particular disease within 2 weeks, since it is a self-limiting disease. And at the same time, because in universal immunization program, the mumps disease is not being included, because of its lower risk for the children. We can say that it is not that much of a concern. Secondly, when we talk about the public health perspective with respect to the mumps disease, so historically, if you look at the measles, this is another viral disease. Okay, measles is another viral disease, and this particular measles disease was prioritized by the public health. Okay, measles was prioritized by the public health. Why? Because it has a potential for severe morbidity and mortality also among the children. Okay, so measles disease was prioritized in public health because it is associated with morbidity and mortality. But unlike measles, mumps is not associated with any mortality and morbidity. And because of that reason, there's the public health perspective is a little less on this mumps disease. And therefore, it has been overshadowing the attention given to the mumps. So since measles is a very dangerous disease, more attention should be given to the measles disease rather than mumps disease. And it has been overshadowing the attention given to the mumps disease. So however, the emerging concern, what should be the emerging concern here? Despite it is less prioritized, there's no doubt that mumps disease is less prioritized by the public health care in India. recent reports have been indicating a surge a surge in the mumps cases, because in Kerala there has been an increase in the mumps diseases among children. And mumps disease is very often also associated with other diseases such as encephalitis and epilepsy and meningitis, acute pancreatitis, and particularly Kozhikode Medical College Hospital. Okay, so the mumps disease is very often associated with all these diseases. Because of that reason, it is a concern for us, and we need to come up with appropriate interventions, and those interventions are very important. So it is a concern because it has also been impacting the reproductive health of the adolescent girls and boys. It is said that the mumps can affect the gonads. So these gonads are reproductive glands in both males and females. So therefore mumps disease has been impacting the gonads. So it has been affecting the gonads. So these gonads are the reproductive organs in both males and females. So therefore it poses a rare but significant risk of infertility and reduced sperm count in the long term among male. Right? So because of that reason, we should take it as a serious public health emergency. So there's no doubt that this particular disease has been spreading like a fire in Kerala. So therefore, we need to consider this as a public health risk. So in this context, why is the mumps vaccine not part of the national immunization schedule? So why it is not included in the schedule of the national immunization? First and foremost, lack of mortality that is associated with the mumps disease. For example, if a child is impacted or affected with the mumps disease, so it is very rare with that particular mumps disease leads to the mortality or morbidity of the child. Okay, so it does not result in fatalities, and further contributing to the belief that it may not warrant inclusion in the routine vaccination schedules. So it is not associated with any mortality and morbidity. So hence there is no need to include this vaccine in the universal immunization program. And this is the perception of the public health agencies. Secondly, underestimation of the public health significance of mumps disease. So the significance of mumps disease is very often underestimated, because despite there are a lot of arguments from organizations like Indian Academy of Pediatrics. So it very often says that mumps is a public health significance or public health emergency, and it is very often underestimated because there has been an insufficient evidence or insufficient data that is being available. And if the data is available, that could encourage the inclusion of mumps vaccine in the national immunization programs. So I mean, essentially it is suggesting that this mumps vaccine should be included in the national immunization program. Even though it is not associated with mortality and morbidity, it has been impacting children's reproductive organs. So therefore it is very important that this should be included in the national immunization program. So after that, poor documentation and lack of studies with respect to the mumps disease is also another factor that leads to the inadequate measures or inadequate steps on the part of the government to deal with the mumps disease. Because so we have a limited documentation of clinical cases, complications, and follow-up data. So as well as there's a scarcity of published studies on the mumps. So this particularly hindered efforts to fully understand its impact and advocate for its vaccine inclusion. Right? So these are some of the challenges. Now, how can the current outbreak be controlled? How can we control this outbreak? So first and foremost, it is emphasized that public awareness campaigns have to be organized. So these public awareness campaigns must focus on providing adequate information about the disease called mumps. And at the same time, the people should be or must be aware about the symptoms of the mumps disease, the transmission, and the importance of isolation. So all these things have to be provided to the people, particularly in those regions where they are considered as hotspots or the spread of this mumps disease is highest. So therefore, we need to further emphasize on vaccination, because vaccination is a method through which we can contain the spread of this mumps disease among children. And we should also encourage children and households to adopt the practices such as wash. So that includes good hygiene practices, maintaining good hygiene practices. So followed by that, improve immunization coverage. So we need to include this mumps vaccine. We need to include the mumps vaccine in the universal immunization program. And we need to further increase the vaccine coverage as well, thereby targeting the unimmunized children and adolescents and ensuring accessibility to vaccine services for all communities. So after that, strict isolation measures are also very important. So if a child is impacted or a group of children are impacted with this particular mumps disease, isolation has to be strictly followed, and there should be a clear guidelines and in the healthcare facilities and even the schools for managing mumps cases and thereby preventing the further spread of the mumps disease. And apart from that, this school closure also, if a school in a school more number of people are infected with the mumps disease, the school closure should be an option. A temporary school closure should be an option that could also prevent a further spread and transmission of this mumps disease, because most of the mumps cases are reported among the young students. So these are some measures that can be adopted to prevent this further spread and transmission of the mumps disease. Now next we'll discuss about Shiv Shakti point. Okay, so we all know that on August 23rd, India successfully landed India's Chandrayaan 3. India's Chandrayaan 3 has successfully landed on the south pole of the moon. Okay, so lander Vikram has successfully landed on the south pole of the moon. So on August 23rd, it is declared that it is National Science Space Day, and at the same time, Chandrayaan 3 touchdown point was named as Shiv Shakti point. So the point where Chandrayaan 3 was touched down in the southern pole of the moon was named as a Shiv Shakti point. So Prime Minister Modi announced that that spot where Chandrayaan 2 left its footprint on the moon in 2019 will be known as Tiranga point. So please remember, we have a series of Chandrayaan missions. Chandrayaan 1, where the spacecraft was intentionally crashed on the surface of the moon, was known as Jawahar point. Okay, so that point is known as Jawahar point. So this particular Jawahar point was suggested by a former president, APJ Abdul Kalam. And secondly, Chandrayaan 2. So where Chandrayaan 2 was crashed on the surface of the moon, Prime Minister Narendra Modi named that particular spot as Tiranga point. Tiranga point. So however, the Chandrayaan 3 successfully launched itself on the moon surface, the southern side of the southern pole of the moon surface. So it is named as Shiv Shakti point, right? So it is being named as the Shiv Shakti point. Now we'll understand this. So recently, International Astronomical Union has recognized that it has sanctioned or recognized the name Statue Shiv Shakti for the landing site of Chandrayaan 3's Vikram lander. So therefore, making a significant milestone in the planetary nomenclature. Okay, so please understand. So this Statue Shiv Shakti point where Chandrayaan 3 was landed successfully. So that was the name given by India to that particular point. However, it also requires the international recognition. It should be internationally recognized, and that particular role would be done by the International Astronomical Union. And here the International Astronomical Union has recognized or sanctioned the name Statue of Shiva Shakti for the landing site of Chandrayaan 3's Vikram lander. Okay, so therefore it is said that it marks one of the important milestones in the India's overall space program, because it gets the international recognition. Now we'll briefly understand about the International Astronomical Union. What exactly is this International Astronomical Union? So this International Astronomical Union was founded in July 28, 1999. Okay, so during the Constitutive Assembly that is being held in Brussels, Belgium. Secondly, so its creation was prompted by the need for international collaboration in astronomy, especially after the First World War. So especially after the devastation that was being caused by the First World War, a need was felt where it is recognized that a collaboration between different countries is required with respect to astronomy. Apart from that, it also aims for promoting safeguarding astronomy in all its aspects through international cooperation, and its headquarters is located in Paris, France. Okay, so this is briefly about the International Atomic Union. Okay, so now understand a few things that as I have already told you that Chandrayaan 1 mission 2008, the site where the probe was intentionally crashed was named as Jawahar Point. Okay, so the objective of the mission was send an orbiter. Okay, send an orbit. Chandrayaan 1's objective was send an orbiter which orbits around moon, and at the same time crash a lander, intentionally crashing a lander on the surface of the moon. And that particular point where the probe was intentionally crashed was known as Jawahar Sthal. Okay, so to honor India's first Prime Minister Jawaharlal Nehru. So Chandrayaan 2 was crashed. So the objective of Chandrayaan is having an orbiter, and apart from that a lander and rover. However, the mission was failed where Chandrayaan 2 lander was crash landed on the moon surface. So the region where Chandrayaan 2 was crash landed named as Tiranga Point. On the other hand, when in August 23rd Chandrayaan 3 successfully landed, Vikram lander successfully landed on the south pole of the moon, so it was named as a Shiva Shakti point, and International Atomic Union has recognized this Shiva Shakti point, so thereby providing it with the international recognition. Now in this context, as I have already discussed with you about the International Astronomical Union. Okay, right, so with respect to Chandrayaan 3, it has it has not sent the orbiter, rather there's a lander and the rover also. Okay, rover is Pragyan rover, and lander Vikram. So Chandrayaan 3 successfully landed on the southern side of the moon, and it has also successfully completed its mission objectives. So it is also said that India is the first country which has successfully landed itself on the southern pole of the moon. Okay, so this is all about the statue Shiva Shakti point and recognition that is being provided to this particular point by International Astronomic Union. Okay, so that's all in this lecture, and thank you so much.